Hello everyone, in this video we will be reviewing the frequently asked questions about the digestive system. The digestive system consists of mouth, pharynx that is throat, esophagus, stomach, small intestine, large intestine, rectum and anus. Digestive system, question number 1. Which of the following is not a part of small intestine? A. Duodenum, B. Ileum, C. Jejunum, D. Cecum. Think the answer. The correct answer is D. Cecum. When you take the small intestine, you can see it have three parts. The first part is duodenum, the middle and or the second part is the jejunum, third or the final part is the ileum. So when you take the cecum, it is the beginning of the large intestine where the ileum connects. You can see the cecum is here. So cecum not the part of small intestine. Question number 2. Which of the following is a function of the pancreas? A. Supplies digestive enzymes. B. Stimulates growth. C. Manufactures melatonin. D. Secretes vasopressin. Think the answer. The correct answer is A. Supplies digestive enzymes. So when you take the pancreas, it has the endocrine and exocrine functions. So the pancreas has both the exocrine and endocrine functions. Its exocrine function involves producing and secreting digestive enzymes like amylase, lipase, and proteases into small intestine to break down carbohydrates, fats, and proteins. Question number 3. At which of the following locations does bile enter the digestive tract? A. Gastroesophageal sphincter. B. Duodenum. C. Ileocecum. D. Jejunum. Think the answer. The correct answer is B. Duodenum. You can see, so this is the liver. Liver secretes the bile. The bile is stored in the gallbladder, and the stored bile enters the duodenum, that is the first part of the small intestine, through the common bile duct to aid the digestion. So here it enters the digestive tract. Question number 4. Which of the following is on the right side of the human body? A. Appendix. B. Sigmoid colon. C. Descending colon. D. Rectum. Think the answer. So the correct answer is A. Appendix. So when you take the anatomical position, you have to know that anatomical right, when a person stands straight and looking at you, the right side will be this side. So this is the right side, this is the left side. So the abdomen can be divided into 4 quadrants. Right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. So when you take the right lower quadrant, you can see it having cecum, appendix, uterus, ovaries. So the appendix is on the right side of the abdomen. So when you take other answers like sigmoid colon, descending colon, and rectum, all are on the left side of the body. That is the anatomical position. Question number 5. A patient sustains severe blunt trauma to the left upper abdomen and requires surgery. Which of the following organ is most likely to be involved? A. Appendix. B. Gallbladder. C. Pancreas. D. Spleen. Think the answer. So the correct answer is D. Spleen. As I explained in the previous question, the abdomen can be divided into 4 quadrants. The spleen is located in the left upper quadrant. You can see here, it tucked under the diaphragm. It is a highly vascular organ and is particularly vulnerable to blunt trauma, making splenic rupture a common concern in such injuries. Question number 6. Saliva contains an enzyme that acts upon which of the following nutrients? A. Starches. B. Proteins. C. Fats. D. Minerals. Think the answer. The correct answer is A. Starches. Saliva contains salivary amylase, also known as thiolin, an enzyme that begins the chemical digestion of carbohydrates, that is, starches, in the mouth. Question number 7. What is the function of the small intestine? A. Absorb nutrients. B. Store bile. C. Filter blood. D. Produce insulin. Think the answer. The correct answer is A. Absorb nutrients. So the primary function of the small intestine is the absorption of nutrients from the digested food into the bloodstream. Microvilli, you can see here. Microvilli in a small intestine primarily function to significantly increase the surface area available for nutrient absorption. This enhanced surface area allows more efficient and rapid absorption of digested food into the bloodstream. Question number 8. Which of these is an accessory organ to digestion? A. Stomach. B. Small intestine. C. Gallbladder. D. Esophagus. Think the answer. The correct answer is C. Gallbladder. So, accessory organs of digestion are those that aid in digestion, but food does not pass through them. So, here you can see the liver, gallbladder, pancreas, and salivary glands are accessory organs of digestion. The gallbladder stores and concentrates bile, which is essential for fat digestion. Question number 9. Pancreas is a part of which two body systems? So there are four answers available. Please pause the video and think the answer. The correct answer is endocrine and gastrointestinal. The pancreas has two main functions. One is endocrine, produces hormones like insulin, glucagon, which regulate blood sugar levels, making it part of the endocrine system. Similarly, exocrine, it produces digestive enzymes that are secreted into the small intestine to break down food, making it an accessory organ of the gastrointestinal system. So, the pancreas is part of the endocrine and gastrointestinal system. Question number 10. Which of the following anatomical regions of abdomen lies just distal to the sternum? A. Epigastric, B. Hypochondriac, C. Hypogastric, D. Lumbar. Think the answer. The correct answer is epigastric. So when you see anatomically, the abdomen can be divided into 9 areas. So below the sternum, the part is called epigastric region. The middle part is umbilical region, and the lower part is hypogastric region. So the right and left to the epigastric region is hypochondric region. Right and left to the umbilical region is the lumbar region. Right and left to the hypogastric region is the right inguinal and the left inguinal region. So the correct answer for this question is A. Question number 11. What is the role of mucus secreted by the stomach? A. To protect the lining of stomach. B. To digest fats. C. To kill the germs in the food. D. To digest the proteins. Think the answer. The correct answer is to protect the lining of the stomach. Inside the stomach, you can see the mucus. The stomach secretes mucus to form a protective barrier. This layer shields the stomach lining from the highly acidic gastric juices, which are necessary for digestion but could otherwise damage the stomach wall. Question number 12. Which is the longest organ of digestive system in the human body? A. Pancreatic duct. B. Small intestine. C. Large intestine. D. Esophagus. Think the answer. The correct answer is B. Small intestine. The small intestine is identified as the longest organ of the human digestive system. Its extensive lengths provide a large surface area for nutrient absorption. Question number 13. In the human body, digestion of protein begins in which of the following organs? A. Liver. B. Mouth. C. Small intestine. D. Stomach. Think the answer. The correct answer is D. Stomach. The digestion of the proteins primarily begins in the stomach, where enzymes like pepsin, activated gastric acid, start breaking down complex protein into smaller polypeptides. Question number 14. The portion of small intestine in anatomical order would be. So there are four answers. Please find the answer. So the correct answer is duodenum, jejunum, ileum. The small intestine is divided into three segments that food passes through in a specific order. The duodenum first, followed by the jejunum, finally the ileum. Question number 15. Which part allows for both food and air to pass through? A. Esophagus, B. Larynx, C. Pharynx, D. Epiglottis. Think the answer. The correct answer is C. Pharynx. You can see the pharynx is here. Through the pharynx, air and food can pass through. But in the larynx, only air can pass because the epiglottis closes when the food passes through the pharynx area. So the pharynx, commonly known as the throat, serves as the common passageway for both the respiratory and digestive systems, allowing both food and air to travel through it. Question number 16. The wall of GI tract from lower esophagus to anal canal has how many layers? A. 2 layers, B. 3 layers, C. 4 layers, D. 5 layers. Think the answer. The correct answer is C. 4 layers. So these layers from the innermost to outermost are, the innermost is first one is the mucosa, then submucosa, then the muscularis layer, and finally the serosa. So those are 4 layers of the gastrointestinal tract. Question number 17. Which organ is not considered as retroperitoneal? A. Pancreas, B. Ascending and descending colon of large intestine, C. Duodenum of small intestine, D. Liver. Think the answer. So the retroperitoneal organs are those located behind the peritoneum, that is, the membrane lining the abdominal cavity. Liver is not considered as retroperitoneal, while pancreas, ascending and descending colon, and the duodenum are the retroperitoneal. So here you can see the retroperitoneal organs list. Those are supraadrenal gland, aorta, duodenum, pancreas, uterus, colon, kidney, esophagus, and rectum. Question number 18. Most of the digestion and absorption of nutrition take place in A. Mouth, B. Stomach, C. Large intestine, D. Small intestine. Think the answer. The correct answer is D. Small intestine. As I explained earlier, the small intestine is the primary site for vast majority of chemical digestion and nutrition absorption in human body. It is specialized structure including villi and microvilli maximizes this process. Question number 19. Which tooth is responsible for grinding and crushing food? A. Incisor, B. Canine, C. Dendrin, D. Molars. Think the answer. The correct answer is D. Molars. So when you look at the types of teeth and the activities, on the front line you can see incisors. These incisors are useful for biting and cutting. And lateral to those incisors, you will get the canine teeth. Canines are used for tearing. After that, you will get the premolars. Premolars helping tearing, crushing, and grinding, and also the molars. Molars are helping for the grinding and chewing. So, molar and premolar tooths are responsible for the grinding and crushing. So, the correct answer is D. Question number 20. What does the hard palate of the human mouth form? So there are 4 answers available. Please pause the video, think the answer. The correct answer is the hard palate of the mouth form the floor of the nasal cavity separating the nasal and oral cavities. Here you can see this is the nasal cavity from the nose, it's going down, and this is the oral cavity, that is mouth. So in the nasal cavity and oral cavity are divided by this hard and soft palates. So the final bonus question, the vestibule of the mouth includes A. Lip tongue cheek, B. Tongue cheek, C. Mucosal and submucosal tissue of the lips and cheeks, D. Lips, cheeks, pharynx. So please give your answer in the comment section. My channel offers guidance for the medical coding, especially to help you to prepare for the AAPC CPC examination. If you have any issues, please feel free to ask me. You can leave your questions in the comment sections, or you can email or WhatsApp me using the details displayed here. If you feel this channel is useful, please subscribe my channel and stay with me. Thank you.